Hi, my name's Ella Maisel and I'm from the CVI Center at Perkins School for the Blind. Today we want to talk about the CVI assessment area of movement of the eyes. When we think about the assessment area of movement of the eyes, we know that individuals with CVI have difficulty controlling their eye movements in order to visually attend. They can have difficulty fixating for visual information for very long. The quality of the shift of gaze can be impacted by less smooth shifting, less sustained attention to the elements of both three-dimensional and two-dimensional elements in order to gather visual details. So all of us, whenever we look at an object, shift our gaze to all the elements. All of us, whenever we look at a picture, shift our gaze to the elements of that picture. Some individuals with CVI have these rhythmic eye movements or nystagmus. When we think about nystagmus, it's this observable, involuntary, and continuous pattern of movement of the eyes. Students will often find a null point or a place to hold their head or their eyes in order to quiet the motion, that rhythmic motion of their eyes. This is very different from what we also see with children with CVI, which is these roving eye movements, which really is lack of visual fixation. What research tells us about this condition is that alternating eye use and distinct eye use preferences are often seen in individuals with CVI. So children may locate something with one eye and then examine it using the other eye. So you see alternating strabismus at times listed on reports. We know that eye teaming is impacted for individuals with CVI. That visual fixation is the basis of any of these oculomotor abilities. And the stable fixation, the ability to look and sustain attention, is a prerequisite for the ultimate visual function or visual recognition. Difficulties with shift of gaze and full oculomotor abilities limit the access to visual information for children with CVI. Eye movement difficulties, including nystagmus, is found prevalent in students with CVI. There are four major types of eye movement. We have saccades, which is the movement that allows us to efficiently shift our gaze and scan the environment or to read. Smooth pursuit, which is the motion of our eyes for tracking with eye-to-object attention. Vergence, which is the ability to use that fine bit of our vision in order to look at a visual target, whether it's at near, where our eyes are converging, or whether it's at further distance. It's the visio-ocular, which is the ability to shift quickly to maintain that detailed vision with shifting scenes and with head and body motions. So we have many disorders of the movement of the eyes when CVI is present. We have strabismus, and in this case, we're really thinking about that alternating esotropia or exotropia, where eyes are used for different kinds of tasks and moved in different ways during those tasks. We think about nystagmus. We can think about inconsistent fixation, those roving eyes, difficulties with following items with eye-to-object contact, not just following movement, but actually having eye-to-object contact. And the ocular motor difficulties, again, vision scanning, scenes, scanning objects. A student will often use head positions and postures in order to compensate for these conditions. These are several images that were done in some research by Yarbrough in 1967. And what they tell us is that we use our shifting detail vision in order to gather visual information from a scene, whether it's in real life or in this case in an image. So the image up on the left is a picture of a person in old-fashioned clothes rising up from a chair in order to greet a man coming through the door. There's a woman holding the door in the doorway, and there's a child sitting at the table. So the intersection of visual attention and language is that visual attention and movement of the eyes will shift according to what the task is. So if you are asking families, if you're asking whether this family is wealthy, then the shift of gaze is going to be to the objects in the room. If you're asking about the age of the people, then the shift of gaze, the movement of the eyes, is going to be to the details of faces. So you can see all the multiple ways that shift of gaze gathers information linked to language, linked to context, and linked to cognition. In order to support this area, we need to provide consistent placement. So children are reducing their need to shift gaze. We're going to control for clutter and crowding. We're going to allow any head positioning, material positioning, or adjusted seating. We're going to support navigation with orientation and mobility, provide frequent breaks because this would be extremely tiring. We want to limit fast-moving situations and activities due to this difficulty of judging speed and distance and shifting to those elements. We're going to consider full visual field access to promote this whole head systematic scanning of the environment. We're going to limit copying from boards or copying from one surface to another, and provide social supports because shifting gaze would certainly be important in social situations. Listening to our voices of CVI, Tina, an adult with CVI, says, CVI is unpredictable. Some days are clearer than others. Today I woke up and my vision was off. My nystagmus likes to work with my CVI to make seeing sometimes impossible. A CVI parent says, I can tell my son's tired or that he's reached his full-on visual fatigue when his already severe nystagmus is noticeable from across the room. And here is a list of some of the current research about this assessment area. Every child with CVI is teachable, and every child has the right to a meaningful and accessible education.